Hi, my name is Bailey Swan, and I'm going to be discussing the brain for you. I've created a 3D model out of Play-Doh, which includes the frontal lobe. First, that's what we're going to talk about. The frontal lobe is in charge of problem solving, language, and motor functions. The parietal lobe right here is in charge of sensory information like pain, touch, and temperature. Right here in blue, we have the occipital lobe, which is in charge of visual cues, form, and color. Right here at the bottom, we have the cerebellum, which is in charge of balance. Right here we have the temporal lobe, which is in charge of emotions, language, and motor functions. And right here we have the amygdala, which is in charge of sensing danger and fear. In the outermost layer, we have this pink Play-Doh, which is called the dura mater, and it is there for protection of the spinal cord and the brain. Right underneath the dura mater, you have the subarachnoid space, which regulates cerebrum, spinal fluid, and nutrients and waste. You have the brainstem right here, which is the lower portion of the brain, which connects to the central canal and the spinal cord. And then the main lobes is the cerebrum. Now we're going to dive into the mid portion of the brain, the innermost layer, which is the ventricles. The C that you see right here shape is going to be the left and right ventricle, which is going to have prongs protruding out, and they're going to insert into three main sites of the brain: the occipital, the temporal, and the frontal. The right ventricle sends blood to the pulmonary arteries, and they send blood to the lungs to be oxygenated. Once the lungs oxygenate this blood, it's going to send to the left atrium, which goes up through the central canal and back to the left ventricle. The left ventricle is going to send this oxygenated blood to the rest of the body through a network of arteries. Inside the left and right ventricle, you're going to see that there is an extension of the central canal, and this includes the third ventricle, which is in charge of producing and secreting cerebral spinal fluid. The fourth ventricle aids in protection of trauma against the brain and also regulates the central canal, and the central canal resides right beside the spinal cord. Now we're going to talk about the basal ganglia and the thalamus, which are also in the mid portion of the brain. They're actually connected. The basal ganglia is in charge of learning functions, motor functions, behavioral and emotional functions, and then the thalamus is in charge of sensory information for touch, pain, temperature, sight, taste, all of them except for hearing. And now that I've discussed the outer layer and the innermost layers of the brain, I'm going to be discussing three different parts of the body. Two of them are going to be muscles in the eyes, which you can see I've created a drawing right here. And the next is going to be a nerve in the face. So I've created a 3D drawing or 3D model of the two muscles in the eye I'm going to be discussing. The top portion is the superior rectus and the bottom portion is the inferior rectus. The superior rectus allows for upward motion of the eyeball, and the inferior rectus allows for the downward movement of the eyeball. And these two muscles are going to connect to three bones in the face. The superior rectus will connect to the frontal lobe, and the inferior rectus will connect to the zygomatic and the maxillary bone in the face. And here is the drawing just so you can visually see those two muscles. And next we're going to be discussing the maxillary nerve in the face. The maxillary nerve, which I've also did a drawing up here, its origin is going to be the trigmenule, which is right here. It's the main nerve, is the trigmenule. The trigmenule branches out into three different nerves in the face. The ophthalmic, which is the top one, the mandibular, which is the bottom one, and then the middle one is the maxillary nerve, which I'm discussing. That's going to run on the maxillary bone, and it's going to have nerves that branch into the upper portion of the jaw and in the nasal cavity and a little bit into the occipital bone. Its main function, the maxillary nerve's main function, is to relay sensory information such as touch, pain, temperature of the upper portion of the jaw and nasal cavity to back to the trigmenule. And then also the insertion side of this trigmenule for the maxillary nerve, it's going to pass through the TMJ, the temporal mandibular joint, right there. So that's all for today.
So today we're going to be talking about the frontal bone, the palatine bone, and the nasal bones. So right here we have the frontal bone, and it is a shell-shaped, unpaired, flat bone of the skull, and it's located in the forehead region. The frontal bone consists of 6 main parts: the squamous part, nasal part, and 2 orbital plates and 2 zygomatic plates. Let's see if I can zoom out a little bit. Oh, there we go. And then now we're going to look at the nasal bones, which are right here. You have your left nasal bone and your right nasal bone. They are two small symmetrical oblong bones, each having two surfaces and four borders. Positioned in the midface at their junction, they form the bridge of the nose superiorly and anchor the upper lateral nasal cartilages inferiorly. So again, here's this side and this side. And the palatine bone, this one is super small. There it is. Click on it, get a little closer. It is in there, real small. And there's the other side. You have a right side and a left side. It is a paired bone located between the maxillae and the pterygoid, I think that said that right, process of the sphenoid bone. It participates in building the three cavities within the skull, the oral cavity, nasal cavity, and the orbits. And there they are again.
Hello, so I'm going to be talking about the vertebral arteries, the maxillary veins, and the facial muscle, the temporalis. So I'm going to do that before I show the vocabulary words that we did. So I'm going to first talk about the maxillary veins. You have right and left. This accompanies the first part of the maxillary artery and enters the parotid gland to unite with the superficial temporal vein to form the retromandibular vein. The maxillary veins accompany the first part of the maxillary artery that pass backwards between the sphenomandibular ligament and the neck of the mandible. They enter the parotid gland to join the superficial temporal vein, forming the retromandibular vein. So I'm going to show you where those are using complete anatomy. I'm using pictures because I use my complete anatomy on my iPad and that's where I'm filming. So this is the best I could do with my 3D model. So I'm going to zoom in. As you can see right there, they're running right behind this mandible right there. So you can see that. All right. I'm going to talk about the vertebral arteries. They ascend through the foramina transversa of the C1 through C6 vertebrae and the foramen magnum to enter the cranial cavity. For descriptive purposes, the course of the artery can be divided into four parts: the cervical, vertebral, suboccipital, and the cranial parts. From its origin, the cervical part of the vertebral artery travels superiorly between the longus colli and the scalenus anterior muscles. So I'm going to show you what that looks like. This is right here. I've got the left one highlighted, and there's one along the other side as well. So that is your vertebral arteries. Let me get out. And then I'm going to lastly talk about the temporalis. So the origin is the temporal fossa and the fascia. The insertion is the coronoid process and the ramus of the mandible. The action elevates and retracts the mandible, so opening and closing your mouth. The arterial supply of it is the anterior and posterior deep temporal arteries and the middle temporal artery. Sorry, I'm just making sure I've told everything I wanted to. Elevates the mandible at the temporomandibular joint. Retracts the mandible at the same joint. So I'm going to show this muscle now from Complete Anatomy. As you can see, sorry, I'm trying to get the lighting to work with me here. It's this muscle here that's highlighted on the side of the head there. And you can see kind of where it runs down to the mandible in here. So that's where it's located. Okay, lastly, I just want to show our definitions. So right here, I have got my definitions, and I think this is what we needed to do. I don't really know if I need to go and read through these, but I can upload them as well. This one's going to be Bailey's. I can upload them as well onto the comments. This is Maddie's. Okay. All right. Thank you.